In this course, you will learn about 2 OSHA regulations that pertain to safety issues directly related to working in healthcare: bloodborne pathogens and needlesticks, also known as sharps. The pathogens that created concerns leading to OSHA's actions were the HIV/AIDS virus and hepatitis B. Bloodborne pathogens are diseases that can be transmitted from person to person through blood and other potentially infectious materials, such as spinal fluid, feces, and saliva. It requires employers to have a written exposure control plan. Initially, this requirement only applied to healthcare organizations. However, it expanded to include any company with 10 or more employees working in healthcare facilities where employees may be exposed to bloodborne pathogens. The purpose of bloodborne pathogen rules are to cover workers normally exposed to these serious pathogens. These workers should be trained on the hazards they are exposed to. Bloodborne pathogens are not limited to just blood. Many other body fluids, like spinal fluid, pericardial, and saliva, may host these pathogens as well. Next, employers are required to provide training about bloodborne diseases to an employee who has the potential to be exposed. For each employee with an occupational exposure incident, the employer will maintain these records for as long as the employee works for the company. When the worker leaves the company, the records must still be maintained for a period of 30 years. These records must be kept confidential. Hepatitis B is a disease that affects the liver. It causes the skin and eyes to become yellowed or jaundiced. Patients often have abdominal pain, fever, and vomiting. They become fatigued and their urine becomes dark. AIDS is the acquired immune deficiency syndrome and reduces the body's ability to fight off normal diseases. Some of the symptoms of AIDS are fever, swollen glands, diarrhea, weight loss, and mental disorientation. Universal precautions are a special measure of control. In this case, all blood or body fluids are assumed to be contaminated. Workers are required to protect themselves from exposure to contaminated blood and other potentially infectious material. This is a very effective approach to infection prevention. It is very important to note that the hepatitis B and Ebola viruses can live in dried blood at normal room temperatures for up to 7 days. However, the HIV/AIDS virus is very fragile and will die within a few hours outside the human body. The 2 other hepatitis viruses vary dramatically. The hepatitis A virus can survive outside the body for months, whereas hepatitis C can live no more than 4 days in dried blood. On December 19, 2019, the U.S. Food and Drug Administration, or FDA, announced the approval of Ervebo, the first FDA-approved vaccine for the prevention of the Ebola virus disease, EVD, caused by Zaire Ebola virus, in individuals 18 years of age or older. There is still no approved vaccination for AIDS and hepatitis C. Regulated waste is not just something to toss into the dumpster. This type of waste must be placed in specified bags and labeled as follows. Bags must be fluorescent orange or red-orange. Lettering must be in a contrasting color. The biohazard symbol must be present on the bag in a contrasting color. The bags must be leak-proof. The Centers for Disease Control and Prevention estimates that clinical workers in hospital settings get stuck by needles and other sharp objects almost 350,000 times each year. If you add the non-hospital technicians, that number increases by an additional 590,000 sticks. That's over 2,500 needle sticks every day. When a needle stick injury occurs, it must be recorded in a needle stick log. It may also be recordable on the OSHA 300 record-keeping log.